Hello and welcome to the topic Open Fractures in the module Orthopaedics. By the end of this session, you should be able to define open fractures, classify open fractures, and apply the principles of management of open fractures. Let's get started. So what is an open fracture? An open fracture is a fracture when there is an open wound or break in the skin near the site of the broken bone. Often, we found that open fractures are caused by some high-energy impact events such as motor vehicle accidents, also gunshot wounds, but can also caused by lower energy incidents such as simple falls or while playing sports. This is the classification used for open fracture called the Costello-Anderson classification. The severity of an open fracture depends upon several factors, such as the size and number of the fracture fragments, the damage to surrounding tissues, and the location of the wound and whether those soft tissues in the area have good blood supply. When a patient comes in with open fracture, it is very important for you to know the classification to help in the management. Open fractures can lead to immediate risk of infection, and patient may require long-term antibiotics and multiple surgical procedures. This diagram shows us the different outcomes observed with different factors contributing to infection sites. Hypothermia and hypovolemia leads to reduced aggregation of polymorphonuclear cells, which lead to poor wound healing. The diagram on the right shows us the right medium that favors wound healing over the site of open fractures. The take-home message here is that providing an appropriate temperature, volume, and oxygen levels are important in promoting open wound healing. In physical examinations, we must check the damage to soft tissues, nerves, and circulation. When there is any wound in the same area as a broken bone, it is assumed that there is an open fracture. The next step is always to get an X-ray. X-rays will help determine the extent of the fracture and show the number of patterns of breaks in the bone. CT scans can also be done if necessary. So let's look at this radiograph. It shows a break in the skin as evident by the protrusion of the bone out of the skin area visible through the X-ray. And this also gives us an idea of how many patterns of breaks occurring in the bone. Next, let's look at how open fractures can be managed. The first step in approaching an open fracture is always to make sure that the patient's pain is well controlled and antibiotics is served, as an open fracture would mean the presence of an open wound, and this would simply mean that there could be a possibility of entry of germs or bacteria. Next, start cleaning and irrigate the wound with at least 2 liters of normal saline and apply clean dressing while waiting for emergency operation to take place. This could be debridement and irrigation, or internal fixation or an external fixation depending on the procedure, which will be according to the severity of the injury. And the final step is to decide whether the fracture management involved an internal or an external fixation. Let us look at the difference. So an internal fixation is done when the wound is clean with minimal skin or tissue damage, and the broken bone can be well aligned. However, an external fixation is done if the wound and broken bones are not ready yet for a permanent implant. An insertion of the metal screws or pins into the bone above and below the fracture site is done, and this stabilizes the broken bone while the wound is being treated. Next, let's look at how a fracture is described. Describing a fracture is a basic requirement when making an assessment in a plain radiograph. So there are many ways to approach the assessment of the X-ray. This is just one of the many approaches. Let's begin. First, you'd want to describe the radiograph. So, what sort of radiograph or radiographs are you looking at? Look at the patient's details, look at the patient's information that's given, the view of the x-ray, and whether is there any rotation present. Next, what type of fracture are you seeing? When describing a fracture, the first thing to mention is the type of fracture it is. They can be broadly split into complete fractures, which is fractures all the way through the bone, transverse fractures straight across the bone, oblique fractures, an oblique line across the bone, spiral, which looks like a corkscrew, comminuted, more than two parts of the fracture, incomplete, where the whole cortex is not broken, bowing, where the long bone has been bent, buckling, where the fracture is of the concave surface, a green stick fracture, where the fracture is on the convex surface, and a Salter-Harris fracture, where fractures that involve the growth plate. Next, once you have identified the type of fracture, you want to look at where the fracture is located at. The next thing is to describe the bone that is involved and what part the bone is affected. For example, could this be a diaphysis, which is the shaft of the bone, or a metaphysis, the widening portion adjacent to the growth plate, or an epiphysis, the end of the bone adjacent to the joint. In some cases, you will also use the anatomical name for the part of the bone, such as the metacarpals have a base, shaft, neck, and head. Next, you'd want to describe if the fracture is displaced or not. So once you have an idea of where it is and what type of fracture it is, you need to be able to describe what it looks like. A fracture displacement describes what has happened to the bone during the fracture. In general, when describing a fracture, the body is assumed to be in an anatomic position, and the injury is then described in terms of the distal component displacement in relation to the proximal component. So if you would like to describe the displacement, it can include one or more of the following: an angulation, a translation, a rotation, distraction, or impaction. Once that is done, you'd want to also look if there's anything else that's going on, such as if there is joint involvement. It is really important to determine whether the joint surface is involved by the fracture. If the fracture does extend to the joint, the patient will probably need to have a different treatment, and it is much more likely that they will need a surgical procedure. And finally, you'd want to ask yourself if there's any other fractures present. Always finish off by checking for other fractures. Also check that you have imaged enough of the patient. If they have pain in the joints above or below a fracture, it may well be worth getting an x-ray of that joint too. Let's look at an example. A complete open fracture of the left distal radius with displacement with no other fractures or joint displacement seen. And this is how we would like to describe this particular x-ray or fracture. Now, when we discuss management, especially medical management, and here we would like to talk about antibiotics. How would we decide the choice of antibiotics? Antibiotic treatment with open fracture management should be administered early, ideally within 3 hours of injury. This tremendously reduces the risk of infection. With the propensity of gram-positive infections with type 1 and 2 fractures, a first-generation cephalosporin is generally recommended. Type 3 fractures often have contamination from gram-negative organisms, and in the case of soil-contaminated wounds, such as wounds occurring following injuries at the farm or roads, additional coverage should be added for anaerobic bacteria. Typically, this would include penicillin for the risk of a clostridial infection. In the treatment of open fractures in the hospital setting, the surgeon must also be concerned for nosocomial infections, namely by Staphylococcus aureus, and aerobic gram-negative bacilli such as Pseudomonas. Specific antibiotic coverage for these organisms may be indicated. The duration of antibiotic therapy in the treatment of open fractures have been suggested to be between 1 to 3 days without any solid agreement on a firm endpoint. To summarize open fractures, first and foremost, learn to recognize an open fracture, which will be based on your clinical examination and correlating with the radiographic findings which are in keeping with the fracture. Next is to classify based on a grading score, which then guides antimicrobial therapy. You will be an important member of the team in the management of open fractures by assisting surgeons during fixing surgeries as well as wound dressing in the ward. Familiarize with the various dressings available, and this will be covered in depth in the wound and bone infections topic. We have come to the end of this session. Thank you.